Welcome to the Ability Beyond Transition Resource Center. This resource center has been developed to help families of individuals living with disabilities navigate the transition process when school-based services end and adult life begins. Module 6, Healthy Living. In the Healthy Living module, we will answer a variety of questions relating to the importance of healthy lifestyles for individuals with disabilities, including: what does healthy living mean? Why is living a healthy life so important for my child? What skills should my child have to lead a healthy life? Who can help my child live a healthy life? How do I move forward to help my child lead a healthy life? All modules contain supplemental materials and worksheets in PDF format. You may choose to either pause the video now and download the material or wait until after viewing the module. So let's begin by answering our first question. What does living healthy mean? Everyone, regardless of their abilities or challenges, has the right to lead a healthy life. And there are many factors that contribute to leading a healthy life. Access to healthy, nourishing food. A phenomenon known as food desert is defined as areas where there is an absence of fresh fruit, vegetables, and other healthy whole foods, usually found in impoverished areas. This is largely due to a lack of grocery stores, farmers markets, and healthy food providers. In food deserts, people rely upon local quickie marts that provide a wealth of processed, sugar, and fat-laden foods that are known contributors to our nation's obesity epidemic. People with disabilities have a higher rate of obesity than people without disabilities. This is due to a variety of reasons, including a lack of healthy food choices, difficulty with chewing or swallowing food, or its taste or texture, medications that can contribute to weight gain, weight loss, and changes in appetite, physical limitations that can reduce a person's ability to exercise, pain and/or a lack of energy, a lack of accessible environments that can enable exercise, a lack of resources like money, transportation, and social support to encourage healthy and active lifestyles. If your child is struggling with obesity, it is important to identify those factors and address them with your healthcare provider, as obesity will greatly impact the quality of life as they become adults. Other health factors include maintaining personal hygiene, having access to routine medical and dental care, having access to emergency medical care, having access to assistive technology that can support greater independence, having a means of learning new skills in order to maintain cognitive health as one gets older. Research shows that adults with many types of disabilities who are living with their families, alone, or in the community with minimal staff support are least likely to engage in preventative activities, least likely to have access to affordable health care, and the most likely to have unique health problems. Research also shows that many people with disabilities living in the community are still seeing their pediatric providers. This is problematic because pediatric providers don't have specialized training or experience to work with adult bodies. Adults, regardless of whether they have a disability or not, need to be seen by competent adult healthcare providers. It is very devaluing for an adult to have to go to a pediatric office. Not just for adults, celebrities, and health aficionados. Maintaining a healthy life is even more important if your child has pre-existing conditions such as asthma, diabetes, seizures, skin conditions, gastrointestinal conditions, or others affecting body systems. This includes your child's emotional health and well-being. Research also shows that people who live a healthy life are more likely to express satisfaction with their life, more successful at work, live longer and more independently, have better relationships with family and friends, are less prone to catching secondary diseases, have greater financial security. Your child needs a variety of skills in order to live a healthy life, including the ability to communicate with providers and know how and when to seek help for health issues. A full list of skills is available in the supplemental materials. In addition to primary care, there are a variety of professionals and places that you can access to improve healthy lifestyles for your child, including Special Olympics Healthy Athletes and Healthy Communities initiatives, community health centers, YMCA or other community resources, private healthcare generalists or specialists who accept your insurance. So let's get going. Start looking for adult providers now. Obtain and review all health records. Compile health records into a single format so, for example, all medications past and present are in one place. There is a timeline of illnesses and provider contact information. Assure your son or daughter has health insurance, which may be Title 19, Medicaid, or private through your own or your child's private insurance. Remember, as of 2018, the Federal Affordable Health Care Act still allows children with disabilities to remain on the insurance of their parents at the state's discretion and may not disallow coverage because of pre-existing conditions. Teach about and assure access to healthy food, exercise opportunities, and personal medical records so they understand their health history and can present it to a provider as needed. And what about sexual health? There are several excellent resources available to you that may access to cover topics related to human development, sexuality education, human rights, and sexual abuse education. The following website provides a full resource guide. There are several excellent curricula available that put dating into the context of overall healthy relationships, including avoiding bullying and other forms of abuse. Module 5 addresses this in more detail. This may be included as part of the transition services provided under the IEP if you don't feel comfortable discussing with your child. Now, please take the time to review the attached PDF, which includes worksheets to help you plan. Thank you for watching the Healthy Lifestyles video. If you have questions or would like to speak with someone about services, please contact us at 888-832-8247. Please share our resource center with your friends and colleagues.